So today I want to talk about something very near and dear to my heart because I feel like so many people are struggling with low thyroid and they've either had lab work done and it's come back fine, but they're still struggling with a lot of symptoms. So I want to talk about some of the symptoms associated with low thyroid today and talk about some solutions for that as well, okay? So if you are struggling with fatigue, dry skin and hair, and this could be loss of hair too, could be another sign. Loss of outer third of the eyebrow. So if you've got some thinning on the edge of the eyebrow, that can be a symptom of low thyroid. Poor memory or brain fog, low body temperature. So this could be in general, like if you take your temperature and it's lower even when you should be, you're not sick or having anything going on, it's just a lower body temperature, or cold hands and feet. Weight gain, constipation, muscle aches, just muscle fatigue even is something that I noticed a long time ago before mine was addressed. Headaches, brittle nails, depression, and then estrogen dominance, basically hormone imbalances that can cause low libido. Estrogen dominance, there's a whole other video we could do on that. I've talked about it before. It's a lot of the hormone imbalances that are going on these days are connected to some of this and why some of the thyroid levels are low. But I wanted to address thyroid specifically today because I feel like so many people are struggling, maybe like I was, where I knew something was off and I initially went to my doctor, several years ago, and they did their thyroid lab work and everything came back fine, and I knew something was off. And this was close to 16 years ago. And was one of the things that was a catalyst to get me on the path to study functional medicine. Was I knew that something was wrong, but I was basically told I was a working mom and I was just tired because I was a working mom. And I knew even back then in my 30s, I shouldn't have been that tired and having a lot of these other symptoms that were going on as well. So fast forward to doing functional medicine lab work and really looking at optimal ranges, I would have been categorized as something called subclinical hypothyroidism, where I just started presenting some of those symptoms, but if I hadn't addressed it through a functional medicine path, I could have been suffering for years before something would have been addressed. And then, unfortunately, what the typical standard of care solution would be to prescribe something like Synthroid, which really doesn't fix why these thyroid issues can be a problem in the first place. And oftentimes I find I have clients that come to me and they've actually been on some of these medications for a long time with no relief in any of these symptoms either. And that's because the upstream reason why the thyroid is out of whack basically has not been addressed. And I always share that the thyroid is basically the canary in the coal mine. It's the first thing that we start to see some of those levels, off when the body has dealt with so much stress. Basically, the stress bucket has overflowed. So that could be chemical, emotional, physical stressors. Typically, it's a combination of all of those that bucket starts overflowing, and we start to see it present in different symptoms in the body. And the thyroid oftentimes is one of the first things that we see as a sign of dysfunction. And I always feel like what a great opportunity for us to address that before we really run into some other issues down the road. So all of that being said, if either A, you have had lab work done and it's checked out and you've been told that everything is fine, I encourage you to dig a little bit deeper. Like what we do in our office is we do a very comprehensive look at the thyroid, where we don't just test the basic levels, but we look at T3, which is the active thyroid hormone. We also test for different antibodies that could show autoimmune thyroid conditions as well, which is typically not something that they're going to run in the doctor's office. And you'd be amazed at how many people these days are starting to display some of these autoimmune tendencies like I was so many years ago. But I want to give you hope. I want to share with you that can be reversed if we work with the right tools to figure out why the body started presenting with some of these symptoms in the first place. I just was able to do some lab work recently and see that all of those markers are completely gone and there are no signs of any of that autoimmune presentation anymore. So just want to give you hope that we can work with all of this if we know what's going on with your specific situation. If you feel like you're struggling with some of these things, or you know someone who is, please feel free to reach out so that we can help you get on the right path to healing. So hopefully that was some helpful information for you. If it was, please like and share this video. We really want to get this information out to the people that really need it. Health and happiness. Have a super fantastic day. Thanks so much.